So there can be a whole range of symptoms. I mean, I think the ones that you'll hear about the most are fever and cough, but there's also sore throat, headache. Sometimes people feel body aches. So there's a whole range, and there's actually people who can have the virus who have no symptoms at all.
Increasingly, what we're seeing is that a number of pharmacies, grocery stores, and frankly, Good Samaritans are stepping up to try and help individuals get delivered goods to their doorfront.
The guidance that we've been giving people is that we only recommend masks for those who have symptoms, or if you're caring for somebody who has symptoms.
But if you think you need emergency care and you're having difficulty breathing, the message is still, please come to your emergency department. Don't try and be rigging up any devices at your home yourself without the guidance of medical professionals.
From the Zoomerplex in historic Liberty Village, the Zoomer with Marissa Lennox.
Welcome to the Zoomer. My name is Marissa Lennox. I'm the Chief Policy Officer at CARP and host of the Zoomer. Today, I'm pleased to welcome Dr. Nathan Stahl, a physician practicing geriatrics and internal medicine at Mount Sinai Hospital, and Dr. Jeff Kwang, a professor at U of T in public health and family medicine. We chose this format, an interactive town hall, to ensure that older adults who have concerns about coronavirus can get access to the information that they need to protect themselves and their families. Our intention is to get to as many of your questions today as possible. But before we dive in, let's tee up the topic.
In December 2019, Chinese authorities notified the world that a virus was spreading. This virus causes the disease known as COVID-19 and is what everyone calls the coronavirus. The majority of people infected by corona will get through it with mild cold-like symptoms. But about 15 to 20% may become severely ill. Those most vulnerable, older adults, and people with underlying medical conditions. While much is still unknown about the virus, it's safe to say the best defense for now is proper hand hygiene and social distancing.
Now, the first question we're going to is from Judy. She is in Sarnia. Judy, you're live on the line. What's your question?
They say the heat kills this virus. Then why isn't it being killed in our homes and in our buildings that are heated?
It's a good question. Dr. Kwang, why don't I start with you?
Yeah, I don't think we have evidence that heat kills the virus. Some people are hoping that as the warm weather approaches, that this virus is going to go away here. But if you look at Australia, they have almost as many cases of us, and they're in towards the end of their summer now. So it's definitely hot weather in Australia, but they still have the virus going pretty strong there. So I wouldn't say that heat kills the virus.
Dr. Stahl, is there anything you'd like to add?
Yeah, just that I've heard this as well, but we've also seen for other viruses like MERS and SARS, there didn't also seem to be a temperature effect as well. So I don't think we can hang our hat on the warmer weather contributing to the eradication of this just yet.
Mm-hmm. Thank you for that question, Judy. Next, we have Reba. Reba, you're live on the line and you're calling from Toronto. What's your question?
My question is, I do have a mask, but I don't know if I have no symptoms of illness. And is there any reason why I should wear this mask when I go out for a walk?
The guidance that we've been giving people is that we only recommend masks for those who have symptoms, or if you're caring for somebody who has symptoms. Mm-hmm. So if you're going out for just a walk by yourself, then that's probably okay to not wear the mask. Okay, as long as you don't get within 2 meters of anybody else, that's fine. In other countries, there are a lot of people using masks, and that's something that I was wondering yesterday is maybe there should be more widespread use of masks. But right now, I mean, the issue is that we just don't have the supply of masks so that everyone can have as many masks as they need. So I think that's why we're recommending to save the masks and not use them if you're just going out for a walk.
Now, Reba, just out of curiosity, have you, I know you don't have any symptoms, but have you been staying home and self-isolating?
Yes, mostly, yes. I've gone out for groceries the odd time.
All right, well, that's good to hear. Okay, well, I hope that you take care. Next on the line, we have John. John's calling from Kingston. You're live, John. What's your question?
Yes, if I were infected with the virus and have recovered after several weeks, is it possible to be reinfected?
Great question. Dr. Stahl.
Yeah, it's a good question and something that I can assure you that researchers around the world are looking into. We simply don't know at this point. So we are assuming and treating individuals that they are at risk of being reinfected. There is some experimental work going on looking at using the serum of patients who have been previously infected with coronavirus and seeing whether giving that serum to others could bring immunity, but it's too early in the virus. So what we're telling, or in this pandemic, so what we're telling people is you still have to treat yourself and follow the same precautions that everyone else is following a coronavirus infection.
Dr. Kwang?
Yeah, I agree exactly as Dr. Stahl said. I think the only thing is that we're hoping that this will become milder over time in terms of, like, as people develop some immunity to it, similar to other human coronaviruses that have been circulating for many years, where it just causes the common cold. So that's the optimistic view, but we really have no idea, and we won't know until we've had more time to collect data on this.
All right, thank you for that question. We need to take a short break. More on COVID-19 when we come back.
So when we're talking about everyone physically distancing, it doesn't mean don't leave your house, but it means leave your house when you need to. And if you are leaving your house, distance, keep that 2 meters or 6 feet from other people.
We have Dr. Nathan Stahl and Dr. Jeff Kwang here. You're tuned in to our special CARP and ZoomerMedia Coronavirus Information Town Hall. Let's get to the next question. Anthony, you're live on the line. What's your question?
Thanks very much. I am a caregiver to my elderly parents in their 80s, and I visit their home every day. What tips can I have to avoid the possibility of transferring the virus to them?
Dr. Stahl.
Yeah, so this is a really tough area for family caregivers like yourselves. So when we talk about physical distancing, this is being somewhat conflated in some regards with self-isolation, which is what we're asking people to do following travel, or certainly those who have had exposure and are under investigation for coronavirus. When we're talking about social distancing from individuals, there are going to be some encounters that are necessary, when it comes to looking after one's parents in terms of helping them with services, providing the day-to-day care that they might require. So the basic things that I would recommend when we're talking about interacting with individuals like older adults who might be at higher risk is coming back to those measures about hand hygiene, respiratory etiquette, and avoiding or not coming out and when you are sick, but also thinking about changing the way you might visit somebody. So we are promoting physical distancing. So if you were visiting them every day and they don't necessarily need direct service or direct support or care from you every day, is there a way you could leverage things like technology to visit them more virtually on occasion? The other thing is when you are visiting in the house is try and maintain that physical separation. So try and maintain that 6 feet or 2 meters when you are in the house. And some of the things we might do with people that we love in our life, whether it's hugging them or embracing them, these are the things we may think about starting to back off doing during this pandemic, but still not totally isolating ourselves from the people we love and may need us at this time.
All right, thank you for that really great question, Anthony. Next on the line, we have Angie, and Angie's calling from Niagara Falls. Let me ask Angie, what's your current situation right now?
Oh, I'm doing absolutely well. I have no health issues, and I flew in from Arizona. I wore a mask, and I had cotton gloves and rubber gloves, and when I got off the flight, I washed my luggage down with that before I brought it in the house. But I don't know what the symptoms are.
Yeah, so there can be a whole range of symptoms. I mean, I think the ones that you'll hear about the most are fever and cough, but there's also sore throat, headache. Sometimes people feel body aches. So there's a whole range, and there's actually people who can have the virus who have no symptoms at all. So it's really hard to necessarily identify whether you have the virus or not. If you have any symptoms at all, we definitely recommend that it's actually mandatory that you self-isolate for 14 days. And we're saying the 14 days because it can take up to 14 days for you to, from the time of infection, develop symptoms. And so after the 14 days, we're pretty confident, we're like close to 99% sure that you're not going to develop symptoms after that.
All right, thank you for that question, Angie. Next, we're going to Bob in Richmond, BC. Hello, Bob. What's your question?
Hi there. Yeah, my question is, my wife and I are self-isolated, but we like to go for our walk every day. Since we're touching the same surfaces and everything at home, it doesn't seem logical to physical distance ourselves when we go on our walks.
Yeah. So, again, this comes back to the language that's being used. So there's a difference, again, between physically distancing, which we're asking all of society to do, and self-isolation, which is being imposed on people who may have the coronavirus or may be returning from travel. So when we're talking about everyone physically distancing, it doesn't mean don't leave your house, but it means leave your house when you need to. And if you are leaving your house, distance, keep that 2 meters or 6 feet from other people. So yes, you're going to be in the home with your wife, and you're not going to be physically distanced in the home. So when you go out for a walk, it doesn't make sense to physically distance from your wife, but it would make sense to physically distance from other people you might encounter on the walk or during the outings you might need to take.
It's a great question. I had the same thought. What about partners? Should they share different beds in order to, ensure you're doing that physical distance? But to your point, I guess that's not all that necessary, Dr. Stahl.
It's not necessary unless the person has the coronavirus or one individual has come back from travel and is self-isolating within the home itself, or they're under investigation for the coronavirus. And actually, the Public Health Agency of Canada has released guidelines on caregivers who do live in the same house on how to interact with that person and maintain your distance, and how to clean surfaces in a more aggressive way to prevent spread within a house. Because we recognize for everyone, it may not be possible for them to move out of the house.
Mm-hmm. All right, next on the line, we have Dillamore. What's your question?
I'm self-quarantined. I'm into my 6th day. And what my question is, I wanted to know how big a role does being tired play as a symptom as to having it? I've been traveling a lot and I'm sleeping a lot, and it's got me a little concerned.
Dr. Kwang.
Yeah, it's possible that fatigue could be one of the symptoms of the coronavirus, but it would be a little bit unusual for it to be the only symptom. So if your only symptom is fatigue, then it's quite possible, especially given that you have been doing a lot of travel lately, that it could just be you're worn down from all your traveling. So I would suggest that you continue to monitor for other symptoms to see if you develop anything else. I think the main worrisome symptom is if you're having shortness of breath, or if you're having chest pains, then you should probably go seek medical attention as soon as possible.
It's a great question. Thank you for that. Now, next on the line, we have Trina. Trina's calling from Edmonton. Hi, Trina. What's your question?
Hi. My question is, when people do get tested to find out if they're positive or negative for the test, how long does it take for them to get their test results back?
Dr. Stahl.
It's a great question. So this is actually varying tremendously across the country and depends on where you live. So in some places, the test result is taking days. At some institutions, it can be in the range of hours. And this is something that individuals and laboratory facilities and certainly the frontline lab staff are working across the country to try and expedite testing as much as possible. But I am aware, I am aware in Toronto of institutions where it is taking up to days to get results back.
We'll be back in a few minutes with more of your questions on COVID-19.
Caremongering, which is groups of Good Samaritans mobilizing together to try and help older adults and other individuals who might be immunocompromised do some of the tasks they may need to in their daily lives that could expose them to the coronavirus.
You're tuned in to our special CARP and ZoomerMedia Coronavirus Information Town Hall. We have Dr. Stahl, Dr. Kwang here to answer your medical questions. Now, I do have a question coming in by email from Bill in Toronto, and what he's asked is it necessary to wear gloves and a mask in a grocery store?
Yeah, that's probably maybe considered overkill, but some, I think if that is what makes you feel comfortable, there's probably little downside to it, other than being sure that you don't touch your face and wash your hands when you take off your gloves. And I mean, I think the reason that people are cautious to recommend gloves is that people tend to touch their masks, and they may infect themselves by touching their mask more often. Mm-hmm. So that's why the general recommendation is not to use masks, at least in North America and Europe. But we can't say, I would say that there's an absence of evidence for the effectiveness of masks for the general public.
All right, and on the lines we have Miss Gentile. Am I pronouncing your name correctly?
It's Mrs. Gentle.
Mrs.
Just like
Gentle.
The word.
All right, and you're calling from Saskatoon, is that right?
That is correct.
All right, tell us what your question is, ma'am.
I'm a wife of a husband that is suffering with trigeminal neuralgia, and so I'm his caregiver and wife, so I have to do most of the work around the house and go out for groceries and prescriptions. How do I protect myself to get prescriptions, especially?
Dr. Stahl.
Yeah, so this is a tremendously difficult time for family caregivers who already were providing immense amount of work across the country, and as you know, unpaid. About 75% of all our direct home and community care services are actually provided by family members like Mrs. Gentle. So what can I tell you? Increasingly what we're seeing is that a number of pharmacies, grocery stores, and frankly, Good Samaritans are stepping up to try and help individuals get delivered goods to their door front, often at no cost. There's a number of emerging movements across the country. We talk a lot about scaremongering, but there's actually a movement that's sort of gone viral, excuse the pun, called caremongering, which is groups of Good Samaritans mobilizing together to try and help older adults and other individuals who might be immunocompromised do some of the tasks they may need to in their daily lives that could expose them to the coronavirus. So certainly I would try and leverage, if you can, all the options that exist to try and bring goods and services to your home without you needing to go out as much. And then when you do need to go out, it's following the sort of precautions that we've talked about. Again, good hand hygiene, respiratory etiquette, maintaining your physical distance from others, making sure you're very vigilant about washing your hands. The other thing I will say, which I've certainly seen here in Toronto, is that some of the stores have actually opened up the first hour for older adults or the immunocompromised, so it allows you to enter into a clean store and away from other individuals. That's sort of a very, I would say, forward-thinking and smart idea that a lot of these chains have done as well. So I think sort of starting to consider differential hours and differential ways you can get things to your home is something we could recommend.
Thank you, Mrs. Gentle, for that important question, for your ongoing contribution. Next on the line, we have Dorothy. Dorothy's calling from Montreal. Dorothy, you're live on the line. What's your question?
I saw somebody post that they could make their own face mask by using a sheet of paper towel and folding it accordion-like, stapling the ends together with elastic bands put over their ears. I don't know if you can imagine that, but do you think that would be effective?
Dr. Stahl.
That's a good question. I've seen this as well. So, all the devices, the masks that would be used by healthcare workers are available for purchase would be regulated. So they've tested these devices. So certainly it'd be difficult to comment on the exact protection that one would receive from this, but we are seeing in other jurisdictions that they're recommending different types of masks or face shields. Some people have been actually using bandanas in the United States as well. I think this is going to depend and evolve as we consider our supply of personal protective equipment, or so-called PPE. We are seeing the government ramping up production. hopefully we won't need to come to that stage. So I would say for the time being, if you need to use masks like that, I would use ones that are regulated rather than trying to fashion them yourself.
We'll be back in a few minutes with more of your questions on COVID-19.
What we've been telling patients is to isolate yourself for up to 48 hours after your symptoms have resolved.
Our special coverage on the coronavirus continues. Let's get to more of your calls. Larry, you're live on the line.
The question is to the doctor. I'd like a rundown of the symptoms that start, say, day 1 and possibly finish in day 14, and when the symptoms of difficulty in breathing take place that possibly you might have to go to the hospital with. And I know it's not, the symptoms are not the same all along, but just on average type of rundown of the symptoms.
Yeah, so I can't say that we can answer your question very well right now, because I think there's a huge amount of variability. So everyone has like slightly different course of their illness. What I can say on average is it's normally about 5 days is the incubation period. And so from the day that you're infected until the day that you show symptoms, they found that on average, that's 5 days. Now, some people will be sooner than that, and some people will be later than that. And then how the virus, the symptoms present can be very different from individual to individual. So some people will have no symptoms the entire time. Some people can start off with the sore throat. Some people start off with a headache. And so unfortunately, I can't say, some people will start having shortness of breath earlier on. Some people, the shortness of breath will come later on. So it's really hard to answer your question, unfortunately.
Dr. Stahl, do you have anything to contribute?
Yeah, so the data that we're having here, and we don't know whether it's all, or that we're using here, and we don't know that it's all fully generalizable to North America, comes from some of the Chinese studies. And generally, when you publish data in a medical journal on the clinical course of something, we have to recognize that many of these cases are biased towards the ones that are most severe. We do think that that once you become infected, it takes a mean time of about 5 days to actually start showing symptoms. And then they looked at some of the studies, how long after you get symptoms does it take until you start to require hospitalization or intensive care in the most severe cases. And again, that seems to be in the range of about another 5 to 7 days. So there is absolutely some lag time from when you actually contract the virus to getting symptoms. And then there is some time, it appears, of progression until one develops severe symptoms. But I wouldn't say by any means that is the rule for this disease. These are limited studies with a small number of patients from an experience in China. So really, we have to be vigilant that this may be presenting in many different ways.
Next, we've got Betsy on the line. Betsy, where are you calling from?
Hi, I'm calling from Pointe Claire, Quebec. I'm living alone at home, and nobody's coming in. I'm not going out. Because I can't pass germs along to anybody else, how important is it to disinfect, touch your face, hand wash, and clean if I'm not exposing to anybody else?
So it's hard for anyone to sort of stay within their house and have no interaction with anybody for a totally indefinite period of time. At some point, we're all going to need goods. We're all going to need to interact or transact with somebody in some way, just because that's how we live our life in order of getting goods and services. So that's one thing, is I think it's inevitable that everyone are going to have some exposure to some people during this pandemic, even though we're physically distancing as much as possible. The other thing that I would say is that we're not aware, and we know this from other settings, of how often we touch our face, how often we may be doing things subconsciously that are habits at baseline that we're now asking people to change. So yes, if you're living in your home and it's not a high sort of thoroughfare area and you don't have lots of people coming through your door, it's likely not necessary to sort of escalate the cleaning protocols. But I think it's good practice to start doing hand hygiene, respiratory etiquette in the case that you are interacting with individuals, or in the case that you eventually need more people coming into your house to support you if you should happen to fall ill. So it's not a direct answer, but that's the best I can tell you.
Next on the line, we've got Alda, and Alda's calling from Ottawa. Alda, what's your question?
My question is, I've had a sore throat for some time. I've self-isolated. Now, if just after the 14 days, what do I do then? Do I continue isolating myself?
Great question. Dr. Kwang.
Yeah, that is a tough question. I mean, what we've been telling patients is to isolate yourself for up to 48 hours after your symptoms have resolved. If you've been having a sore throat for more than 14 days, then it might be worth contacting your physician or again, just to see, because maybe there's something else going on that might need to be looked into.
All right, next on the line, we have Ramona. Ramona, hi, can you hear us?
Yes, I can hear you. I have two points I'd like to make. A lot of my friends here in White Rock, South Surrey, are sending me all kinds of information, and some of it is quite spooky. I'd like to know the doctor's opinion on this one. It says it comes from CDC, Center for Disease Control, and it says by the time you're coughing and can't breathe, you're done. So Taiwanese experts are suggesting you check yourself every morning, take a deep breath, hold your breath for more than 10 seconds. If you complete this successfully without coughing, without discomfort, stuffiness, or tightness, it proves no fibrosis in the lungs and therefore no infection. How true is that? It doesn't sound right to me.
Dr. Stahl.
Yeah, so a lot of things to unpack there. Yeah, so the CDC, the Centers for Disease Control and Prevention in the United States, did release data last week on coronavirus. So just to unpack that part, there were a couple major findings that I think are relevant to the discussion. Overwhelmingly, the people who die from coronavirus infection are older adults. But and the other thing that this showed, which we're seeing increasingly, is that young people, though earlier in the pandemic it was felt that they were relatively spared from the coronavirus, they actually do seem to experience severe infections as well and require hospitalization. And there are reports, certainly in Canada as well, of younger individuals with the coronavirus being on ventilators. That's the first point with respect to the CDC. Now, with respect to sort of these specific, or with respect to by the time you get the virus and get symptoms that it's too late and you die, that certainly would not be true. There are people who are getting the virus actually requiring intensive care unit admissions with support from ventilators and who are surviving the infection. So certainly that's not a point to declare futility and avoid care or withdraw care at that time. The third thing with respect to the specific maneuver that's supposedly recommended by the Taiwanese, that's not certainly anything I'm aware of or something that frontline practitioners or our public health agencies are advising in Canada. There certainly could be many underlying conditions that could predispose you to having alterations in that maneuver you're describing. I would not rely on something like that. I think it speaks to the larger issue of trusting information and taking information in from reputable sources for our public health agencies, our governments, and really your primary care practitioner and frontline clinicians that you already have in your circle of care.
We need to take a short break. More on COVID-19 next.
To isolate the individual who has symptoms. So that means they should have their, stay in their own room as much as possible. Use like separate bathroom if that's possible.
We have Dr. Nathan Stahl and Dr. Jeff Kwang here. You're tuned in to our special CARP and ZoomerMedia Coronavirus Information Town Hall. Let's head back to the lines. Nilo is calling from Ottawa. Nilo, you're live. What's your question?
It is twofold in a way. Very briefly, I am prone to asthma and bronchitis. I was born with congenital asthma. So my question here is, for somebody like me who has been tested because I was overseas, has a certificate to say that we're clear, I still cough just because that's me. Now, I would like to go and see a physician because I know it's been too long and it's annoying everybody around me. So I know the symptoms as to when I'm supposed to start an antibiotic and when I'm not. am trusted to do that by the physicians. What do I do in that instance? If I go out and I cough, everybody looks at me as if I'm going to pop off. But it's not the case. It's something to do with my internal system.
Dr. Stahl.
Yeah, so it's a bit about the times that we're living in right now. You're right. Coughing in public places has become terrifying for people, and probably one of the biggest sort of things you can do to get people to run away from you at present. It's difficult to give specific medical advice. If you think you need to see your primary care practitioner or physician, you should contact them. They may be offering different ways of connecting with you or assessing you, whether that's through virtual options increasingly, which I think is good, particularly for people who don't necessarily need to come into the office. And I think for individuals like you who have underlying respiratory conditions, the reason to sort of try and distance yourself and seek virtual care options when appropriate is also not so much putting others off by your coughing, but also recognizing you might be at slightly higher risk than other individuals, and you want to make sure you're as physically distanced from everyone else as possible as well.
All right, Nilo, thank you for that question. Next on the line, we've got Andrea. Andrea, where are you calling from?
I'm calling from Barrie, Ontario.
And what's your situation, Andrea, and what's your question?
I've been trying to find where we can get masks in town, and I have no idea. I can't seem to find any anywhere. So I realize that the nurses and doctors need them far more than I do. But I was just wondering, are they going to be available for everyone soon?
Dr. Kwang.
Yeah, my understanding is that there are a lot of companies trying to increase their production, and like last week, the government saying that other companies are trying to help produce medical supplies. I don't know the details of the timelines for how soon they're going to be able to increase the supply of essential things like masks, but hopefully they'll be able to get it done soon, because we definitely do need more of them. In the meantime, I guess my advice would be just to try to stay at home as much as possible, and to take advantage of these delivery services, whether they're for groceries or medications. It's really quite amazing what is available now. A lot of stores and pharmacies will offer delivery services, and you can also ask for volunteers, your neighbors, your family members who might be able to help with that as well.
All right, thank you for your question, Andrea. Up next, we've got Bill, and Bill's calling from Winnipeg. Hi, Bill.
My condition is probably more sinus issues. I'm often sniffling, and I have been for a long time. My doctor seems to think it's an allergy that's involved, but going out in public, when I start sniffling, people are really quite taken aback. Is it one of the signs?
Yeah, good question. So, the challenge with something like coronavirus is that the symptoms initially often present like any other respiratory virus. So yes, you could have sniffling as your presenting sort of symptom of coronavirus, and that has occurred for individuals. I think it speaks to, again, the fact that if you are sniffling and coughing, you mentioned going out in public, that should probably be minimized at this time, especially as everyone's being asked to be socially distant. But yes, absolutely, sniffing, coughing, respiratory symptoms, fever, particularly in individuals who have had recent travel or exposure to somebody who has coronavirus. But now, as we see community transmission, I think it's fair to say that you don't necessarily have to have travel or the exposure to someone with coronavirus to contract the coronavirus. So certainly those symptoms could represent coronavirus.
So then at what point would you get tested for it, Dr. Kwang?
Well, I think I would say that you can try one of those online self-assessment tools, and or call your local public health department and see what their recommendation is, whether you should be going to an assessment center or going to see your doctor. If you do have a history of allergies, you might want to talk to your doctor if antihistamines might be appropriate for you, so that you can get rid of those symptoms, the sniffling that you're having, so that if that gets rid of your symptoms and that's not coronavirus, then probably.
All right, thank you for that question. Margo is next on the line, calling from Brampton. Margo, hi there, what's your question?
Yes, thank you for taking the call. I live in, I'm a senior, my husband's 60, and we live in a multi-family home, but my son's here, and also every second week we get our grandchildren. Now, I just wondered if someone contracted the actual coronavirus, what is the protocol? I hear different things. Would that person, I mean, obviously they would have to be tested too, but does the person who actually has the virus isolate in a bedroom, for instance, and everybody else, or is it this case everybody's in the same home, so we just act as if everybody's got the virus?
That's a great question. Dr. Kwang.
Yeah, so what I'd recommend is to isolate the individual who has symptoms. So that means they should have their, stay in their own room as much as possible, use like separate bathroom if that's possible, use separate cutlery, eating utensils, everything like that, so that they don't pass on the virus to other people living in the household. And then also to have more cleaning, to clean all surfaces, at least once a day, especially the ones that are, touched often, like things like doorknobs, light switches, handles for drawers and the refrigerator, those sorts of items, so they shouldn't be hanging around and watching TV with everybody else because they could be passing it on to other members in the household.
Public Health Agency of Canada does actually have guidelines for this on caregivers that are available on their website, which go into the details you might want to take if this should happen. So something I'd recommend people referencing.
All right, we'll be right back after this short break. You're tuned in to our special CARP and ZoomerMedia Coronavirus Information Town Hall. We have just a few minutes left, so we'll head back to the lines. And who do we have next? We've got Larissa. Larissa, you're live. What's your question?
So much for taking my question. I think that as many of us have become recently much more informed than we were, say, a few weeks ago, I think it's only natural that, and I don't think I'm alone when I say this, we look back and think, that virus or that flu or that cold that I had in January, February, could it have been that? Especially if we have traveled and reported it to our doctors, but you still have doubts. I'm wondering if is there a test, or will there be a test available to show maybe the presence of antibodies, or to show evidence that somebody has had it? Is such a test valuable? Or is that something that's being looked at by the research community?
Dr. Stahl.
Yeah, so the question of immunity is certainly being looked at, which we touched on earlier in the call. I would argue that most of the efforts right now in terms of testing are focused on ramping up testing for individuals right now, as opposed to looking at individuals who might have been exposed in the past. I would say, our first case in Canada that we know of, which was travel related, happened on January 25th, 2020. We don't have an exact time, speaking to the sort of limits of testing that we have in our country of when we believe community transmission occurred in all jurisdictions. But I would be hesitant to label many of the common sort of cold and other respiratory viruses that individuals had in January and February as being coronavirus. And again, I think that most of the testing right now and most people looking at this are focused on just getting the people who need tests right now as opposed to looking for prior evidence of infection.
Mm-hmm. Dr. Kwang, is there anything that you'd like to add?
Yeah, I absolutely agree with what Dr. Stahl said. And so just to put things into perspective, out of the first 1,000 or people or so who were tested for coronavirus, and these were people mostly who were travelers and had symptoms already, only about 1%, 1.5% came back positive for coronavirus, and about 40% came back positive for other respiratory viruses. So there's, the problem in the winter, there are lots of other viruses. That said, I think this is an excellent question. I think one day there will be a test to look at immunity. I don't think that's the priority right now, but maybe down the road that will be. We will have that available so that we can see who has been infected and who's still susceptible. Although we don't know if people who have had the infection, they may still be susceptible to have reinfection. We just don't know that yet.
All right, and I'd just like to let the callers on the line know that the number for the national COVID line set up by the Public Health Agency of Canada is 1-833-784-4397. I'll repeat that, 1-833-784-4397. All right, thank you for that question. Let's head to Marie next. You're live on the air. What's your question?
My question is about the CPAP machines. There's many individuals that use those machines during the sleep at night. And that machine, there's a device that you can adapt to the oxygen to enhance the air. In the case that the person has difficulty in breathing and they need more oxygen until get to the hospital, can you use the CPAP machine as a supplier for oxygen?
Yeah, so as jurisdictions, so one of the fears around coronavirus is, do we have a supply of mechanical ventilators to sustain the burden of infection we might be experiencing? Adapting devices like CPAP machines is one of the things that's being looked at an extreme shortage. I'm very hopeful we don't reach that level. What people are trying to do on the CPAP machines is not so much administer the oxygen, which is what we can do by having a mask or nasal cannula of oxygen, but actually trying increasing the pressure in the CPAP machine to try and open up the airways, which is some of the things that mechanical ventilators do. They don't just deliver the oxygen, but they also apply what's called positive pressure to help ventilate the individual. So certainly trying to look at adapting these devices are being used as an emergency sort of contingency plan. But if you think you need emergency care and you're having difficulty breathing, the message is still, please come to your emergency department. Don't try and be rigging up any devices at your home yourself without the guidance of medical professionals.
That's all the time we have. If you have any additional questions on COVID-19, please email us at advocacy@carp.ca. For those who were unable to make this live session, or if you'd like to share what's been covered today with others, please visit carp.ca for the full recording of today's discussion. Thank you for joining us. For now, it's time to zoom out.